أقدم لكم الدكتور سعود بن خالد الدغيثر، وسيتحدث عن تخصص الجراحة العامة. سحبناكم من التخصص الباطنة للجراحة العامة. complete different thinking, complete different pathway. تفضل دكتور سعود.
Assalamu alaikum warahmatullahi wabarakatuh. صباحكم الله بالخير. Today inshallah we're going to talk about the general surgery specialty. My name is Saud الدغيثر. I'm a general surgery registrar in Prince Mohammed bin Abdulaziz Hospital. First thing we're going to talk here about our objectives are going to be what is general surgery, as we formulated as a question, and why choosing general surgery, how can I apply, and what are the choices, and what to look for in a program. When we started saying what is general surgery, before when we say a general surgeon, he's a person who has the capabilities to operate from head to toe. However, this terminology nowadays is a bit different because you can see neurosurgery nowadays is a different specialty. You can see the way I'm mentioning it, that general surgery before was doing all type of procedures. However, nowadays, general surgery could not really perform neurosurgery, cannot perform urology, cannot perform head and neck surgery, cannot perform cardiac surgery, and cannot perform plastic surgery. So if we're saying, so what is general surgery? These are the specialties which are under the umbrella of general surgery. Colorectal surgery, I think everybody knows colorectal surgery. It's surgeons who operate on the colon and the rectum and the anal area. We have hepatobiliary surgeons who are able to operate on the liver, pancreas, and the biliary system. Breast endocrine, patients who operate on breast cancer, patients who operate on thyroid cancer, surgeons who operate on thyroid cancer, upper GI and bariatric surgery, who operate on the stomach and mainly do the obesity type of surgeries. You can see also trauma and acute care, which is a new emerging specialty within our specialty, general surgery, where these will handle acute conditions of general surgery and handle trauma. And we can know that trauma is really common in our country, and there is an increase in need of trauma and acute care surgeons. You can see I'm putting the other specialties in red, which is thoracic surgery, because nowadays there is a lot of there's a division between general surgery and thoracic surgery. Thoracic surgery more joining cardiothoracic surgery. Vascular surgery nowadays in some centers in North America are a different specialty, not under the umbrella of general surgery. However, in Saudi Arabia, they're still under the umbrella of general surgery. Pediatric surgery also in the Saudi Commission nowadays, it's a different specialty. It's not under the umbrella of general surgery. Oncology surgery is nowadays a dying specialty because these surgeons were operating on all type of cancers or all type of malignancies. However, nowadays, each specialty will handle their own malignancy. So we'll go to the question, why choosing general surgery? We'll start first by the pros. It's an interesting specialty. Usually surgical specialties are interesting compared to other specialties. You do have clinics, you do have OR, you do have ward rounds. You're not stick to a certain type of lifestyle. You're talking about good income. Most of general surgery specialties have a good income, where you can have, if you work usually in private, you'll have a really interesting income. And there's good outcome of those patients. If you consider, I will not talk about specific specialties, but usually your patients are young. Usually you see the outcome of your intervention in front of you. And that's sometimes interesting for the surgeon. And also you have a variety of specialties, as we've mentioned and seen before. Need of general surgeons. Most hospitals in Saudi Arabia will need general surgeons and need increasing number of general surgeons. And when you talk about applying to the Saudi Health Commission, it's less competitive. I will not say it's not competitive, but it's less competitive compared to dermatology, plastic surgery. However, if you talk about the cons, you'll talk about long working hours, you'll have the on-calls, you'll have the really heavy on-calls where sometimes you're not sleeping these on-calls, especially when you're talking about residency. You'll talk about poor social life. Even sometimes when you're a consultant, you'll still have to come to the hospital to operate on your patients, even if you're a consultant. You'll talk about highly competitive. You see, I mentioned in between brackets working. During your residency, all surgical specialties are competitive. You really need to prove yourself to the consultant to get more clinical skills and more exposure, not like other specialties. And during if you're talking also about general surgery, one of the cons is you need always to improve your skills. You don't need only to read and improve your knowledge. You also need to improve your skills. And I'll talk about that specifically at the end. Our third question is, how can I apply and what are the choices? what's limited is, I could say, Saudi board and study abroad. If you're talking about the Saudi board, the main centers are in Riyadh, Jeddah, Eastern Province, and Southern Province. In Riyadh, we have about 20 centers. In Jeddah, 20. In Eastern Province, 10. And in the Southern Province, we have 6 centers. I will not say what's the best center, but I would say you're the one who would choose what's the best center. You need to look for a center. You need to look for high volume, and also you need a good supervision. Some people would say, let's go to this hospital, for instance, because they have a lot of patients, and they will allow me to work in the OR, nobody will monitor me. That's not a good center, especially in general surgery and other surgical specialties. You really need to look for a center that has high volume plus a supervised training. When I'm talking about studying abroad, there's also Canada and USA. They are similar to the Saudi board. They have 5 years of training. In France also, they do have 5 years of training, but the problem in France is you're usually stuck to a professor, so it's not that monitored training. I'll just talk here specifically about Riyadh. Last year, they've applied about 500 to the Saudi specialties, and the thing is they only accepted about 58, which is about 10% of the applicants. When you talk about Saudi board, junior years are about 3 years, R1, R2, R3. During these years, you're expected to be rounding in the round. You're less working in the OR compared to the senior years. Out of these 3 years, you have 12 months. You can rotate in the ER, 3 months, ICU, 3 months, plastic surgery, about 6 weeks, and elective, whatever you choose, about 6 weeks. Then you can have about 6 weeks in vascular surgery and 6 weeks in pediatric surgery. In senior years, you're expected to lead the rounds. You're expected more to be in the OR. And these senior years, you're expected to stay for about 12 months in your hospital, which are your center, and 12 months to rotate out of your hospital. When I'm concluding, as a surgeon, you really need to be a hard worker. You really need to show yourself, to earn, to go to the OR and take your chance to operate. You need to be a really team player. In the surgical specialties, you're not only working with nurses and patients, you're working with nurses, you're working with anesthesia, you're working with other health allied specialties, including respiratory therapists and other ones. So you really need to develop a skill how to be a team player. And also with your own residents, colleagues, you need to develop this skill, because really it's a hard specialty. You really don't have time. So you really need to know how to be in a team and how to organize the work in the proper way. Also, you need mutual respect. I'd say it's in all specialties. But again, you need to really mutual respect, because as I mentioned, you'll work with a lot of people, nurses, you'll work with anesthesia. So if you don't have that sense of mutual respect, you really have a hard time. You need to balance 2 things. As a surgeon, you really need to be confident. However, you should avoid overconfidence. All surgical specialties, you really need to be confident. You need to go to the OR, you need to have a gut, you need to work, you need to have the ability to take the scalpel and open. However, overconfidence sometimes, you might harm the patient. So it's really the residency time where you can really develop this skill to balance between these 2 things, confidence and overconfidence. And as I've mentioned, improve your skills. You don't need only to work. You really need to improve your skills. What I mean by improve your skills, you really need to have courses, surgical courses, because sometimes if you work in a hospital, let's be realistic. Not all surgeons would come and say, come my dear, let me teach you how to do noting. Unless you have the skills how to do a note, nobody will give you the chance in the OR over a patient. So you really need to trace your defects, your defects in your skills, and improve them, either by courses or by yourself, either having your senior to stay aside and teach you how to do things. That's one of the things, plus medical knowledge. Thank you very much. And if there will be any questions.
We would like to thank Dr. Saud for his presentation, and you noticed the difference between Dr. Sam and Dr. Saud. Dr. Sam, he was elaborating more and more, and Dr. Saud, he was to the point. This is the difference between medicine and surgery. So, any questions?
As an undergraduate, how would I know if I have the ability to be in the surgical field? How do I know if I'm interested?
I can't. You cannot say how I know I'm interested. As I mentioned, there is a pros and cons. Some people would say I'm interested in general surgery. I do like to find good income in my outcome in my patients, and I'm interested. But however, when he starts the internship and he finds the on-calls and the routine, can you tolerate it? So it's based on you. Some people could not tolerate 24-hour on-call. Yeah, for instance, cannot tolerate heavy on-calls where you're not just following patients in the ER or in the ward, where you're just really operating and staying, sometimes not eating. So it depends on you, on your capabilities. Can you handle heavy on-calls? But if you mean by personality, as we mentioned, the personality of a surgeon usually someone who looks for, he's usually in a rush. He looks for the outcome very quickly, not like medical people who are really interested in finding the diagnosis. Our interest as surgeon mainly is finding the patient from changes his condition from bad to good, abruptly.
So I would only know if I try it, you mean? If I try that in the
If you're having an interest in general surgery, that I advise you to take more of your elective rotations in surgical specialties and you examine yourself. Can you proceed or not?
Thank you so much.
You're welcome.
Any other questions?
السلام عليكم دكتور.
عليكم السلام.
يعطيك العافية. بالنسبة للتعامل مع المرضى، هل بيكون في تعامل كثير؟
I think this, as any other specialty, you're at the end of the day, you're a physician. I would not say a surgeon. You're a physician. You need to go your rounds. You're seeing your patients in the morning before surgery. You're seeing your patients in the OR, and you're seeing them afterwards. So I don't think there will be a difference between any surgical or medical specialties in regards to communication with the patient.
السلام عليكم.
السلام.
وش الشروط اللي نحتاجها عشان البروجرام في فرنسا من ناحية السيرجري؟
Nowadays, France, you can go there if you apply usually through the French embassy, and if you're accepted, I think you need to go there for at least 1 year and study French language. So again, as any other specialties, it's your CV. If you do have surgical experience, they do like people with surgical experience. So I've heard some of the gentlemen here mentioning that after fellowship, can I stay 1 or 2 years? Every specialty abroad, they want you to know that are you experienced or not? Because usually surgical skills they need, surgical specialty needs someone who's skilled. They don't want to start with you from the zero level. They want someone who has at least basic skills, and they can take it from there. So most of my colleagues who are accepted in France, at least they work for 1 or 2 years in Saudi Arabia. They've been there, studied at least for 1 year French language, then they proceeded their specialty. Any other questions?
Any other questions? We have time. أي سؤال؟ عندك سؤال ثاني؟ Okay. So نشكر الدكتور سعود بن خالد الدغيثر على ما قدم، ونقدم له هذه الجائزة وهذه الهدية. عفوا على ما قدم.